Hello and happy Monday, March 18th. Come read some health and science news with me. All right, so let's see. All right, so this first article, USA Today, Art and Science, how bracketologists, did not know that was a phrase, are using artificial intelligence this March Madness. How cool is this? They have found that machine learning alone cannot quite solve the limited data and incalculable human elements of the big dance. All these things are art and science. They're just as much human psychology as they are statistics. So basically what they're doing is they're fine-tuning mathematical functions in pursuit of the most objective model for predicting success in the upcoming tournament. And so some people are using AI, artificial intelligence, to perfect their codes or to decide which aspects of the team resumes they should weigh most heavily. Look at that. Science, statistics, crossover with sports. We love. So interesting. All right, next article. Okay, this is NPR, published this morning. The title is From Anxiety to Cancer, the Evidence Against Ultra-Processed Foods Piles Up. Now, this is something that has been tackled by Unbiased Science. I just posted an episode with Dr. Ids where we talk about processed foods and ultra-processed foods. In this article, they're citing a study published in the British Medical Journal that found that people who consume high amounts of ultra-processed foods have an increased risk of anxiety, depression, obesity, metabolic syndrome, certain cancers, including colorectal cancer and premature death. Now, I'm going to do a deep dive on this study, so I'm not going to go too in-depth here. First of all, this was an observational study, and I'm not convinced they did a very good job controlling for other confounding variables that are undoubtedly impacting these outcomes that they're listing here. I'm not convinced yet by this that processed foods in and of themselves are harmful or inherently harmful, but there are factors to consider, like the hyperpalatability of these foods and the proportion of our diet comprised of these foods. So more to come. This next article comes to us from AP News. A lovely headline. State Medicaid offices target dead people's homes to recoup their health care costs. Okay, so they're talking about this one family. This man lost his battle with cancer, but then the state of Massachusetts billed her $177,000 for her father's Medicaid expenses and threatened to sue for his home if his daughter did not pay quickly. Okay, so remember, Medicaid is controlled by states. It's a state-run program, although it does receive some federal funding. And so the rules are going to vary state by state. Yikes. A person's home is typically exempt from qualifying for Medicaid, but it is subject to the estate recovery process for those who were over 55 and used Medicaid to pay for long-term care. But then, so I guess it was recently proposed that this particular program be cut. It also collects too little, roughly 1% of the more than $150 billion that Medicaid spends yearly on long-term care. And people are arguing that many states fail to warn people who sign up for Medicaid that big bills and claims to their property might await their family once they die. There was this 2021 report from the Medicaid and CHIP Payment and Access Commission, which makes policy recommendations to Congress. So some states will put a lien on a home while others don't. Some Medicaid offices try to recoup all medical costs from patients, like doctor visits and prescriptions, while others just pursue the costs for long-term care. So sounds like this varies from state to state. Okay, this article is also from NPR. Watching a solar eclipse without the right filters can cause eye damage. This is a really cool article because it details how and why we can damage our light-sensitive retina of our eyes. And while it's important to wear certain eye protection, let's see. So the article is talking about specific cases of people who were hospitalized because they damaged their eyes when looking directly at the 2017 solar eclipse. And I did not know this, but the article links to, let's see, this website is eclipse.aas.org. AAS is the American Astronomical Society. And so they actually list the different manufacturers that sell both eclipse glasses, handheld solar viewers, and solar filter sheets and rolls so that we could safely view. Who knew? I did not. Okay, let's see. This next article comes from Axios Richmond. So this is a Virginia-specific publication. And the title is Your Poop is Tracking Public Health Threats in Virginia for Now. Okay, so we've talked about wastewater surveillance. It's a great way. It's a technology that can help us detect viruses in people's feces, obviously in the wastewater, even if they have not been tested or if they show no symptoms. So it's a great way to estimate disease burden in different places. So in this article, they're talking about how there are certain locations and properties that are not represented by wastewater testing. So there are basically gaps in surveillance. So it's imperfect. But it has been used for tracking COVID, for tracking flu, RSV. Briefly, it was used to track Mpox. Oh, wow. There is also limited funding. Excuse me. This is interesting. There was a plan to track, a 5-year plan to track fentanyl via sewage systems. That's interesting. So I guess San Francisco did that, but there's limited funding, and so the Virginia Department of Health was not able to carry that out. But there is a proposed budget in Virginia that sets aside $400,000 in 2025 for a 1-year pilot program to do it in 3 locations. So eyes on wastewater surveillance is a very interesting public health tool. So this last article comes from the Washington Post. This was published today. The title is Medicare Pays Millions for Remote Vital Sign Monitoring. Is it worth it? COVID really changed so much, including the way that we diagnose and treat patients. There was an increase in telehealth, as we know. So remote monitoring has become a lot more popular. But this article is saying that it's the Wild West where any patient can get it if a doctor decides it's reasonable or necessary. In 2019, Medicare made it easier for doctors to bill for monitoring routine vital signs such as blood pressure, weight, and blood sugar. Previously, it was restricted to it was limited to certain patients, such as those with a pacemaker. So there have been changes to the way that clinicians will get paid for using this. We're seeing that in just the first 2 full years, remote monitoring services billed to Medicare grew from fewer than 134,000 to 2.4 million in 2021, and that's based on analysis of federal records. Okay, let's see here. So there are concerns about fraud. There's this need to balance giving access patients to this emerging technology that can actually be used to improve health outcomes, of course, but we also need to make sure that we're combating fraud and making proper payments to providers. There's also not a whole lot of evidence that shows that this remote monitoring can actually improve patient outcomes. It's unclear which patients are helped most and how long they need to be monitored. I do think this is a very interesting direction for healthcare, right? This telemonitoring, especially when we know that there are major barriers to access to care. We just have to figure out a way to do this properly. Well, I hope you enjoyed reading some of the latest news articles that pertain to health and science. I'm going to keep going here while I finish my breakfast. Hope you all have a great week.